Hello students, welcome to Pharma Syndrome YouTube channel, and today is our discussion on alpha adrenergic receptors. So simply, what is the location and what is the function, and what is the signal transduction of alpha adrenergic receptors. So as you know, alpha adrenergic receptors are comes under the sympathetic nervous system, and both alpha 1 as well as alpha 2 receptors are belongs to G protein coupled receptors. So here let's start with the alpha 1 receptors. So again, there is a subtype of alpha 1, alpha 1A. So the alpha 1A receptor is located on the prostate gland, especially the selective alpha 1A receptor blocker tamsulosin used in the tumor of the prostate gland. So apart from alpha 1, the subtype of alpha 1 is alpha 1A that is located on the prostate gland. So here regarding alpha 1 adrenergic receptor, the signal transduction is G alpha Q and especially DAG IP3, DAG or IP3. So as I mentioned in the receptor pharmacology itself, signal transduction is responsible for a switch on or off mechanism of the receptor. If receptor to promote its action or if receptor to shut down its action, it is depend on the signal transduction, like a switch on, switch off mechanism. So when you are switch on, the fan is rotating. When you are switch off, the fan is not rotating. Because when you putting your hand on the signal, there is a something is happening in the electric board. So like that here also, when ligand molecules are interacting with the receptor, within the receptor, there is a some message is transferring. The message transfer is simply signal transduction. Here the signal transduction system in the alpha 1 receptor is G alpha Q, and the secondary messengers are DAG as well as IP3. When this diacylglycerol inocetal triphosphate levels are increases, it ultimately increase the calcium levels. So regarding the location and functions of alpha 1 receptor, on blood vessel alpha 1 receptors are present. When DAG IP3 system activated, it increases the calcium. Increased calcium on the blood vessel causes vasoconstriction. And the alpha 1 receptors are also present on the eye. Stimulation of alpha 1 receptors in eye causes mydriasis, that is dilation of pupil of eye because of relaxation of the sphincter muscle. And the alpha 1 receptors are also present on the urinary bladder. When alpha 1 receptors are stimulated on the urinary bladder, there is a relaxation of urinary bladder, and urination will be opposed, and there is a retention of the urine. And these alpha 1 receptors are also present on the kidney, that is JG cells, juxtaglomerular cells. When kidney cells are innervated by the alpha 1 adrenergic receptor, there is a inhibition of the renin release. If renin release was inhibited, then there is a no activation of renin angiotensin aldosterone system. And again, these alpha 1 receptors are also present in the liver. When alpha 1 receptors present in the liver are stimulated or innervated, it leads to glycogenolysis, breakdown of glycogen into the glucose. So this is regarding description of the alpha 1 adrenergic receptors. Next one is alpha 2 adrenergic receptor. The signal transduction here is G alpha IR naught, means simply inhibition. The G alpha IR naught is opposite to the G alpha S. When G alpha IR naught signal transduction is activated, there is a decreased adenyl cyclase AC enzyme and decreased cyclic KNP, secondary messenger production. I hope you know secondary messengers are important for the biological action, physiological action, nothing but pharmacological action. So here it is a inhibitory signal transduction. It reduces the neurotransmitter release. Regarding location and function, the alpha 2 receptors are located in the central nervous system. The alpha 2 receptors are located in the central nervous system. So what happened when alpha 2 receptors in the CNS activated? It inhibit the noradrenaline release. It inhibit the noradrenaline release and reduces sympathetic outflow to the periphery. So generally in the peripheral system, when sympathetic system is more, the sympathetic system is more active, it leads to increased blood pressure as well as hypertension. So during that condition, from the central nervous system, there is an activation of alpha-2 receptors. In the CNS, when alpha-2 receptors are activated, there is a decreased sympathetic outflow to the periphery and reduce the blood pressure as well as hypertension. That's why alpha-2 receptor agonists are used in treatment of hypertension, like clonidine. Apart from CNS, alpha-2 receptors are also present on the pancreas. So on the pancreas, when alpha-2 receptors are stimulated, it inhibits the insulin secretion. I hope you know parasympathetic acetylcholine on pancreas increase the insulin secretion, but sympathetic is opposite to the parasympathetic. So through alpha-2 receptor inhibit the insulin secretion, nothing but release. The effect of alpha-2 on the platelets is a platelet aggregation. So there is a mistake here. So effect of alpha-2 receptors on the platelets is aggregation of the platelets. When alpha-2 receptors are stimulated, it promotes the platelet aggregation. Next, on the GAT, the effect of alpha-2 receptors on the GAT. So alpha-2 receptors are also present on the gastrointestinal tract. When alpha-2 receptors are innervated or activated on the GAT, there is a decreased peristaltic movements, and this is because of inhibition of acetylcholine release on the parasympathetic nervous system. So generally, parasympathetic acetylcholine on GAT increase the peristaltic movement and promotes digestion and absorption. But here, the alpha-2 receptors are sympathetic adrenergic receptors. They oppose the acetylcholine parasympathetic action on the GAT, and they are reducing the peristaltic movements by inhibition of the release of acetylcholine from parasympathetic nervous system. So this is a simple description regarding the alpha adrenergic receptors. So for more information, follow our channel. Thank you.